High cholesterol doesn't announce itself. Plaque builds up slowly along your artery walls over years, quietly narrowing the space for blood to flow. Because there are no obvious symptoms, no pain, no shortness of breath, waiting until you feel something guarantees you miss the problem until it becomes a medical emergency. To catch that buildup early, you have to look at your blood, and that leaves you with a practical trade-off. Buy a rapid home kit for immediate convenience, or take the time to book a full clinic panel. The rapid total cholesterol test is the fastest option. It uses a quick finger prick to give you a single, broad screening number right at home. Think of a total cholesterol test like weighing a closed suitcase. You get the total weight, but can't see what's inside. A full clinic panel unpacks that bag, separating the weight into distinct categories: your HDL, LDL, and triglycerides. Getting that level of detail requires a doctor's appointment and having a lab draw your blood. It takes more effort than a home kit. Neither test is inherently wrong. They are just built to answer entirely different medical questions. Effective testing requires matching the diagnostic depth of the tool to your specific health risks. A home kit is highly convenient, letting you skip the waiting room completely. But its main limitation is right there in the name. It gives you a broad total. It acts as a quick screening tool, providing a single data point you can compare against healthy guidelines to see if your level is within the expected range. Look at this diagram showing two identical high total cholesterol scores. One person has high levels of protective HDL. The other has high levels of plaque-building LDL. Relying solely on a total test makes those very different biological realities look exactly the same. When you see a high total number without the context of a full breakdown, it's difficult to know what to fix. This uncertainty often drives people to try broad, aggressive lifestyle changes, like sudden fad diets, before they even know which specific lipid needs attention. Cutting out entire food groups based on a single number is shooting in the dark. You don't even know which specific lipid is out of balance. A high reading on a rapid test is a prompt to talk to your doctor. It is a reason to get a full panel, not a final medical diagnosis. The speed of a home kit is a great advantage, provided you don't use that limited data to treat complex biological issues entirely on your own. When you finally step into a clinic, you move past broad estimates and get exact clinical diagnostic data. Doctors use a specific mathematical metric called a cardiovascular risk score to predict your likelihood of heart disease over the next 10 years. This formula illustrates how they calculate it. The equation requires exact inputs for HDL, LDL, and triglycerides to output a reliable risk percentage. Plugging in a single total number makes the formula fail. You cannot calculate true risk without the breakdown. The full panel reveals the crucial balance in your blood, the ratio of particles that build arterial plaque versus the particles that help clear it away. This highlights a built-in redundancy for home testing. If a rapid kit tells you your total is high, your doctor will order a full lipid panel anyway to investigate the cause. Taking the time to book a lab appointment is the mandatory price for getting information that a doctor can actually use to treat you safely. Along with your lipid numbers, clinical guidance factors in your age, your blood pressure, and existing conditions to build a complete profile of your health. A total cholesterol test acts as your check engine light. The full lipid panel is the diagnostic readout you need to actually fix the engine. Deciding whether to buy a home kit or book a clinic visit comes down to your current health baseline and your specific risk factors. We can map this choice using a simple decision tree. It all starts with one question: who are you? Profile 1 is the proactive beginner. You are generally healthy, over 40, and looking for a low-friction way to check your baseline. For you, the rapid home kit makes sense. You trade a small cost to bypass clinic wait times and gain immediate early warning awareness. Profile 2 is the at-risk monitor. You manage conditions like high blood pressure, diabetes, or have a family history of heart disease. You should skip the home kit entirely. Your baseline risk requires the granular, precise data only a full diagnostic panel provides. Profile 3 is the optimizer or patient. You have had high results in the past, or you are considering starting, stopping, or adjusting statin medication. Total tests do not provide enough detail to safely adjust medication. Clinical labs and doctor supervision are strictly required here. Spending time or money on a health test only benefits you if the resulting data perfectly matches the specific medical decisions you need to make.